What does informed consent for Invega, otherwise known as paliperidone, look like? My name is Dr. Ruth Dotton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing. And I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. So today we're talking about Invega, which is otherwise known as paliperidone. And paliperidone is the active metabolite of risperidone, otherwise known as Risperdal. So they are functionally basically equivalent in the body. We primarily are going to use paliperidone when it's in its long-acting injectable version. So there's something called Invega Sustenna, and this particular formulation lasts about 4 weeks in someone's system. However, there are longer-acting versions, Invega Trinza, for example, which can last for 3 months. Risperidone also has a long-acting injectable version called Risperdal Consta. However, this one does need to be administered every 2 weeks. One of the other benefits of the Invega version is that you're basically immediately in steady state with the medication after you get the injection, whereas with the Risperdal Consta, you have to supplement orally for quite some time to allow for that medication to get into steady state. We usually are going to use the Risperdal pills over Invega pills because primarily the Invega requires a prior authorization and may not be covered by insurance. But if someone has responded well to risperidone in the past, they're likely to respond well to Invega and vice versa. So what are the side effects that I warn patients about? So it's going to be the same as I would for Risperdal. So there are the side effects that can happen with almost any psychotropic medication, right? So issues like headache, fatigue, sedation, stomach upset, and then there's going to be the metabolic side effects. So that includes things like increased appetite, increased weight gain, increased risk of cholesterol and blood sugar issues. And because of this, if someone is on this medication, they do require annual screening labs for metabolic conditions. So we're going to check your complete blood count. We're going to check a comprehensive metabolic panel, a lipid panel, as well as a hemoglobin A1C, which is a measure of your average blood sugar over the last 3 months. And then lastly, there's going to be the extrapyramidal symptoms. So basically medication-induced movement disorders. So this can include things like akathisia, where you have an intense sense of internal restlessness and you need to move, or a dystonia, where there is an acute muscle contraction that you can't control, or tardive dyskinesia, where there can be repetitive muscle movements that develop over time, or there can be Parkinsonian symptoms, where you develop things like slowed gait, a resting tremor, masked facies, and cogwheel rigidity of the muscles. Like risperidone, Invega is one of the most typical of the atypical antipsychotics, which means basically that the risk of these extrapyramidal symptoms is greater with the Invega than with a lot of the other atypical antipsychotics, and that risk gets higher as the dosage gets higher. Other things that are unique to paliperidone and risperidone that we need to monitor for are the prolactin levels. So there is a risk of elevated prolactin levels, which can lead to things like gynecomastia in men, which is where there's a growth of the breast tissue, lactation in women. There can be sexual side effects like decreased libido, difficulty achieving orgasm, and there can also be menstrual irregularities in women. So in addition to those other metabolic screening labs that I mentioned, it's also important to screen for prolactin levels, especially if they're having any of these symptoms. We're also going to warn people about the risk of SI and the fact that, like most antipsychotics, Invega is going to decrease the seizure threshold. There's also the risk of neuroleptic malignant syndrome whenever someone is taking an antipsychotic, and so it's important that they are aware of that as well. It can also prolong the QT interval, and if this is too long, then it increases your risk of a dangerous arrhythmia. So it's important that someone has an EKG on file, which basically measures how your heart is beating. There's also a risk of orthostatic hypotension, and there is a black box warning on the use of all atypical antipsychotics in the elderly with dementia because it increases the risk of mortality. So although this medication can be a good option for many, there certainly are risks to be considered, and so it's important to make sure that the potential benefits of the medication outweigh the risks. If there's another psychiatric medication that you want to hear me go through the informed consent process for, then please put it in the comments below. I'm also putting together an email list for those of you who are interested in my content so that if I have future resources or courses or offerings, I can share them directly with you all. So if that's you, send me a DM with your email, and I'll see you in the next one.